This is a funny, I don't know. I mean, Barack Obama announced that the healthcare team would be headed by Joe Biden. The president admitted that the team has many problems to overcome. The biggest one that Joe Biden is heading the team. Now, if you can't make fun of Joe, who can you make fun of? I think he sets himself up pretty good. He's kind of like the Democrats' Dan Quayle, let's face it. All right, healthcare legislation. And again, guys, I'm not going to talk about healthcare legislation, all the rules and all that good stuff. But I am going to talk about the tax ramifications and some of the things that you can do within that to kind of, well, there we go. We got some stuff that's happening right now. A lot of people are asking about the small business credit. Yep, there's a credit, and nope, you don't qualify. Or if you do qualify, it's such a small dollar amount that, I mean, we ran this on several of our clients. And okay, $100 to, you know, for the credit. We only charge $200 to run the credit. No. But the rule was you got to pay 50% of the health insurance, and then the problem comes in. Here's who's going to qualify. If you have about 10 employees and you don't pay them anything, they'll qualify. So that's why they qualified at Bertolas and Pekula. You know. But the problem is they seasonally adjust. So if you have seasonal employees, they figured out for 2,000 hours. I'm pointing at Sheila because we did it for them and they didn't qualify.
Thanks.
Yeah, we didn't tell you. We just did. You'll get on your next statement.
Okay.
But that's the only way it's going to work. I mean, about your average wage has to be 25 or less, 25,000 or less for all your employees on the average. And if you bring someone in, a manager will throw it on. We had plumbers and electricians we tried. People that lay floor for a living. You know, the trades, they didn't qualify. So it's kind of a unique one, but if you know that, look, my workforce is relatively low skilled, and you might have a chance at this credit, but for the most part we've tried and it hasn't been that great. You have to have 25 or less employees, and they have to make 50,000 or less, but in reality it's probably about 25 or less to make the credit really work. Health insurance, up to 27 years old. It'd be great if they also extended the tax code to say that your dependent can be 27 or under, but they didn't. But yeah, you have, you know, if all insurance now has to cover those 26-year-olds. My favorite one. There's a 10% tax on excise tax on tanning. So for all you people that are going to jet out of here after the holidays on vacation to someplace warm and sunny, you're going to pay an extra 10% because I guarantee those tanning salons are going to pass it along. Why they pick on them, I don't know. They must have had a really bad lobbyist. They made someone mad. And obviously, part of the healthcare legislation, we need to talk about adoption credits, right? Because that makes perfect sense. There's the adoption credit is now refundable, which is good, and it went up $1,000. So if you're thinking about adopting or you have had an adoption, definitely talk to your tax advisor because there are some changes with that, of course, in the healthcare legislation. 2011. These are some of the big changes that are coming up, and the ones we are really really worried about. Some of the details and limits and penalties. HSAs. Man, we loved our health savings account, didn't we? Small business owners love the health savings account, and now we're shrinking that way down. $2,500. To take money out of a health savings account because now you have this money in there and it doesn't cover anything anymore. Nothing over the counter anymore. They called it a really. You want to talk about bad public policy? I have a friend who's got a child with disability, and they need special pillows, special toys, different things that this child has to have. And he was able to put everything in a flex spending account, and then pay for those special medical devices out of that flex spending account. He can't anymore. That's bad public policy, in my opinion. That's exactly what we should have tax law to help out, is those folks. But now, with the limits being so low, that's not going to happen. And if you try to take money out of your health savings account, the penalty just went way up. Ryan, what's the penalty on a health savings account withdrawal if it's not for qualified med? 20%. 20%. That's your money that you put in. That, by the way, you got to pay tax on too.
Derek,
20%.
Derek, where are the healthcare expense police on this? Where are they? Who's policing that?
The IRS. They're coming.
Okay.
We'll get there. We'll get to the IRS in a little bit. That's my second favorite topic. Jenny really cringes when I talk about the IRS. You're gonna get audited. No, no. You get your clients audited, and then no. One thing that was gonna happen that I have in my notes that didn't happen, and this is gonna be a recurring theme I think with the IRS, is they said, you know what? Because Congress told the IRS, hey, we want health care benefit, the benefit for the employee on their W-2. It's not what the employee paid, but what the employer paid for the employee. We want that on the W-2 in 2011. And the IRS went, we're not ready for that. What? We're not ready for that. We can't handle that. So they, you know what they did? They said, okay, we're not going to enforce it. 2012 though, you be ready. So that's a recurring theme you're going to see. The IRS is not able to handle what Congress wants them to do because they don't have the money yet. And they'll get the money. They're working on that part. But that's one of the things that in 2011, that's not going to happen. Now that's 2012, and now 2012 is my favorite topic. And this is probably one that all small business owners have heard about. 1099, everybody for everything. Right now, you have to issue a 1099. If you pay non-employee compensation or attorneys or some other specific, very specific things, over $600. 600 more, actually. Well, in the healthcare legislation, they passed something, they snuck something in page 1,872, made that up, but they snuck something in there and said, hey, you have to issue 1099s for all services and purchases over $600 to everybody, not just unincorporated folks, incorporated folks. We're talking Menards, Home Depot, Walmart. You spend more than $600, you have to issue these ginormous corporations a 1099. Well, they don't care. They can get all that paperwork handled. But there was a study done in Pennsylvania as soon as this came out, a Chamber of Commerce. They polled like 200 of their members, and they said, on the average, how many 1099s do you think you're going to send out? 250 1099s you're going to have to send out in 2012. That means you better start tracking it January 1st, 2012 at the latest, if not sooner. I mean, that's ridiculous. And I think some politicians thought it was ridiculous. And everybody's like, oh, this and the IRS said, we can't handle this. Our trade association said, oh, don't worry about it. They're going to get that out of there. 2 weeks ago, there was, maybe last week, they had a food safety bill that went through. And Max Backus, who is the ranking Democrat on the Senate Finance Committee, he put in an amendment that would have eliminated that one key clause. Democrat could not get the votes. Did not pass. Didn't pass. So now there could be reasons for that. There could be other Democrats that say, hey, we just passed this legislation last year and you're trying to repeal some of it. Okay, I get that. There could be Republicans saying, you know what? I don't care what you do. I'm not going along with you. But most of the Republicans did. The problem was the rules that they'd set in place for an amendment were 2/3. 61 votes they got for this. This is a terrible, terrible piece of policy for small business owners. This should be a no-brainer. Well, at least that's what we thought. So as it stands, it's still there. We think this is one of the first things on the chopping block, but we thought that that was a no-brainer 2 weeks ago. I mean, I went to my continuing ed, and they said, oh, that's going to go away. They're going to pass that. That's going to be done. Don't worry about that one. Well, I'm still worried. So now we have some of these rules, some of these things that are going on. We don't start paying for them until 2013. The biggie is anybody that makes over $200,000 is going to pay an additional 4% tax. That's the biggie. And the problem comes into play if you, for example, what if you sold appreciated real estate in 2013, right? I mean, you sold, hey, real estate market could come back. It could come back, you know. What if it does, and you sell appreciated property and you make a $200,000 gain on it? You know, hey, we only have capital gains rates, right? 15%, awesome, because they're going to extend that, we know for sure. You have an additional 4% tax on that year, on anything over $200,000. So that's when they start paying for it, is 2013. Now that's an odd year. Why would they pass something in 2010 and have tax increases kick in 2013? Because it's after an election year. The taxes don't. We're going to talk about politics here pretty soon. But 2014, Dan talked a little bit about 2014. That's when you have to have insurance. If you do not have insurance, the insurance police will come after you, and they are called the IRS. 16,000 new IRS agents are supposed to be hired in order to simply police that one fact. Now, the way it's going to look on a tax return is they're going to have a line, how much was your medical insurance? Did you have health insurance? Yep. Send that sucker in. Who's going to put no on that thing? No, not me. Come get me. Well, if I'm doing your taxes and not insurance, I'm going to do it. So that's how hard is that to audit? Oh, here's the news. Go get them. And some people are going to opt out. I mean, it's actually going to be cheaper for people to opt out, pay the penalty, and say, got me. Well, that's not a real good return. I mean, if we're trying to, if health insurance for everyone's a good idea, why would we make it cheaper to not have it? That doesn't make any sense. These are the tax things that are in the healthcare legislation. Who knows what's going to happen with this? I mean, you've seen polls. I'm sure anybody that follows politics at all, the polls, saying that up to 60% of people want to repeal this, down to 30% of people want to repeal it. Who knows? I don't know. And not a lot of it's been implemented, but these are some of the things that we know for sure they're going to happen right now, and we got to be ready for them. That's all that is. So, I know a lot of people always ask, when do I have to have insurance? 2014. Until then, be sick on your own time.